I would like to get some more information about hyperbaric because you mentioned it a little bit earlier. First, I'd like to point out that we are absolutely blessed that we have such advanced technology at NASH, right? NASH's administrative coordination and the input that they provide to us in supporting truly a state-of-the-art wound care center. I've worked at multiple hospitals through my 25 years, and I honestly have never been to any wound care center that is as advanced as the one at NASH. There's one in Wilson, can't hold a candle to this. There's none in Edgecombe. And really, this is just a premier institution. And one of the things that you hinted to was hyperbaric oxygen. That's a device that helps us optimize the oxygen levels in the tissues. Explain that a little bit to us, and then we'll if there's no questions on that, then we'll start talking about the other hat that you wear.
Well, hyperbaric oxygen has been, it's a modality that has unequivocal benefits for certain diseases and equivocal benefits for others.
Meaning it's darn good for some and okay for others.
Yeah.
Yeah.
It delivers oxygen, and we think of it as oxygen as a drug. It delivers oxygen in massive quantities to the serum, which then circulates to the blood that circulates in the body. Now, most oxygen is carried in the red blood cells, but some is carried in the fluid of the blood itself. Not all of it is in the red blood cells. And so what we affect is the oxygen that's in the fluid of the blood. And we drive the level. We will take, for instance, now I don't want to get too specific, but just for everybody out there, the atmospheric pressure that we live under is 760 millibars of mercury. So what we do is that we double that. We put patients in a chamber and increase the pressure so that rather than 760, it's twice 760.
Their whole body, they sit in something?
You're exposed, it's the equivalent of being under 33 feet of water.
Whoa, okay.
But instead of breathing the room air, we pump in 100% oxygen. So what that does, and without going through the calculations, it takes, it basically increases the oxygen that's in the fluid part of your blood. It increases that level by 10 or 15 times.
You breathe it in, and then it goes into your vascular system, and that's how it increases.
Yes.
Because I pictured putting your foot in there and having that bombarded with something.
Your whole body is inside of a tank. So that your internal oxygen level is just is literally 10 times what it was. We're careful. In there are medical precautions that you have to take when you get under that pressure and give that much oxygen. We're aware of those, and we do it very carefully. But what the patient is getting is this massive, large dose of oxygen, which improves healing and it decreases infection. It unequivocally is the treatment for radiation-induced hemorrhagic cystitis. So people men who've had radiation treatment for prostate cancer and develop blood in the urine from radiation-induced cystitis, we can treat that with hyperbaric oxygen very successfully. And we have patients that are referred from Greenville. We have patients that are referred from all of Eastern North Carolina who have a wound care center for that. Another condition that's unequivocally benefited by this is what they call osteoradionecrosis, where people have had head and neck irradiation, usually for head and neck cancers, and they develop problems in their jaw. And they sometimes will have to have their teeth removed, but they end up with infections in their jaw. Well, the treatment for that is hyperbaric oxygen. And we have patients, once again, from all over Eastern North Carolina from oral surgeon and dentist in Greenville and everywhere. So we're very fortunate to have two, what we call monoplace, where one patient is in one chamber, hyperbaric oxygen chambers here in Nash County.
We really are. That was really interesting. I had no idea.
An impressively high-tech institution we run here, yeah.
Thank you for doing that, Dr. Brantley. I hope I never need it, but I mean, I'm really glad to know we have it locally. I've heard of people with like a foot wound who've ended up using the hyperbaric chamber.
We use hyperbaric oxygen for diabetic foot ulcers at certain stages. So we try to blend that with the other therapies, and if that's beneficial, we usually can find a way to make it work for the patient.